Hi everyone, welcome back to my YouTube channel and today we are going to talk about atrial fibrillation. So let's start our topic with introduction. Atrial fibrillation is most common chronic cardiac arrhythmias that are encountered in clinical practice. It is characterized by rapid, irregular electrical activity in the atria that lead to ineffective atrial contraction and irregular ventricular response. This condition significantly increases the risk of stroke, heart failure, and overall mortality. Definition of atrial fibrillation. Atrial fibrillation is a supraventricular arrhythmia that is marked by uncoordinated atrial activation and ineffective atrial contraction that result in an irregular ventricular rhythm. Etiology of atrial fibrillation. Atrial fibrillation occurs due to disturbance in electrical conduction system of heart. Common causes include hypertension, coronary artery disease, valvular heart disease, especially mitral valve disorders, heart failure, cardiomyopathy, hyperthyroidism, excessive alcohol intake, post-cardiac surgery, and congenital heart disease. These all are the common causes that can lead to atrial fibrillation. Risk factors for atrial fibrillation. Several factors increase the likelihood of developing atrial fibrillation. They include advanced age, male gender, hypertension, diabetes mellitus, obesity, smoking, sleep apnea, and chronic kidney disease. Pathophysiology of atrial fibrillation. In atrial fibrillation, multiple ectopic foci generate rapid electrical impulses within the atria. This chaotic electrical activity prevents normal atrial depolarization and contraction. As a result, atrial blood flow becomes stagnant and particularly in the left atrial appendage, predisposing it to thrombus formation. And the irregular atrial impulses are partially transmitted to the ventricles that lead to an irregular ventricular rate. Classification of atrial fibrillation. Atrial fibrillation is classified based on duration and recurrence. Classification include paroxysmal atrial fibrillation, in which episodes are there but they terminate simultaneously within 7 days. Then there is persistent atrial fibrillation. In these episodes of atrial fibrillation last longer than 7 days and require intervention. Then there is long-standing persistent atrial fibrillation, that is continuous atrial fibrillation that lasts more than 12 months. Then there is permanent atrial fibrillation, that is continuous atrial fibrillation where rhythm control is no longer pursued. Clinical manifestation of atrial fibrillation. Symptoms vary widely among individuals and may be intermittent or persistent. Common signs and symptoms include palpitations, irregular pulse, shortness of breath, fatigue, dizziness or lightheadedness, chest discomfort, reduced exercise tolerance, and some patients may remain asymptomatic and are diagnosed incidentally. Diagnostic investigation for atrial fibrillation. Diagnosis of atrial fibrillation is primarily based on electrocardiogram that show absence of P waves and irregular rhythm. Diagnosis can also be done by Holter monitoring, echocardiography, and blood tests including thyroid function test. Management of atrial fibrillation. The goal of management of atrial fibrillation include rate control, rhythm control, and prevention of thromboembolism and treatment of underlying cause. First we do is rate control that can be done by beta blockers and calcium channel blockers and digoxin. Then we do is rhythm control that can be done by antiarrhythmic drugs, electric cardioversion, and catheter ablation. Then we can do is anticoagulation therapy to prevent thromboembolism that can be done by oral anticoagulants to prevent stroke and also by long-term anticoagulation based on individual risk assessment. Complication of atrial fibrillation. If left untreated, atrial fibrillation may lead to ischemic stroke, heart failure, thromboembolism, cardiomyopathy, and reduced quality of life. Prevention of atrial fibrillation. Atrial fibrillation can be prevented by control of blood pressure and diabetes, by maintaining healthy diet and regular exercise, by limiting alcohol intake, by early treatment of heart disease, and by regular medical follow-up. Conclusion of this lecture video. Atrial fibrillation is a common and serious cardiac arrhythmia that is associated with significant morbidity and mortality. Early diagnosis, appropriate medical management, and lifestyle modifications are essential to reduce complications such as stroke and heart failure. Comprehensive patient education and adherence to treatment play a vital role in long-term management. And this was all about atrial fibrillation. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.